Ready? Good afternoon, everybody. Rich Fitzgerald, County Executive here at the Allegheny County Health Department with Dr. Deborah Bogan. And obviously the fact that we're coming to you on a Sunday afternoon tells you the seriousness of where we are. The last time we talked on a Sunday afternoon was on March 15th when we did the first shutdown here in Allegheny County. We have seen some alarming spikes in our positive test numbers over the last week, and particularly over the last couple of days. We actually had more positive tests in the last 2 days than we had in the previous 2 weeks. So it's a very serious situation, and we're going to talk about some restrictions that are going to be imposed in the coming days. Excuse me. I've been in contact with the governor's office, Governor Wolf, Secretary Levine. They've been very helpful and very supportive over the last couple of days, and I can tell you Dr. Bogan and her team have been working all weekend, pouring through these numbers, looking at the contact tracing results, finding out where these hot spots are and what we can do to mitigate it. We do not want to be what some places around the country have been that have not had restrictions and not taken it seriously. And for the most part, the folks in this region have really been responsible for 3.5 months since mid-March. Businesses, individuals, retail establishments, et cetera, have been very good. But we've seen a couple of hot spots that have occurred over these last, really since we came into the green back on June the 5th. The problem with this disease at times is it's a lagging indicator. So things that happened 2 weeks ago show up 2 weeks later. One of the things Dr. Bogan's going to talk about is right now our hospitalizations and fatalities remain low. We certainly hope that continues, but it often is something that happens after high test numbers go up, and we've seen that around the country. The places we've seen hotspots are bars and travel, and we are going to be making an announcement that bars are going to be closed. Restaurants will remain open, not to be able to serve alcohol, except for takeout alcohol that are in line with state restrictions. We're also going to enforce the masks. When you're in a restaurant, you have to wear your mask. We're going to encourage outdoor seating at restaurants. We know being outdoors, being physically distant, wearing your mask is the best way to avoid this. When you're inside without a mask, in close contact for long periods of time, that really ups the potential for spread and for people to get it, and that's what our contact tracing has shown. I've also been in contact, I want to thank Mayor Peduto, also in contact working this weekend to make sure. He has said that there will be fast-track permitting for outdoor seating in our city neighborhoods, and we're hoping that other municipalities in the permitting that goes on will encourage that, because if people are outside doing their dining, that's what we want to do. We want to recommend that be the case. But we are going to insist that people wear their masks when they're in restaurants, except for when the food comes. For the first time since this began, Allegheny County had the highest positive tests in the state. You know, we had talked about southwestern Pennsylvania and Allegheny County being low week after week, month after month. Well, that's no longer the case. Our friends in the southeast have seen their numbers flatten out, and our numbers are excuse me, heading in the wrong direction. So we want to make sure that we can contain this and we can flatten this curve and send it back down the other way. So we want to be very strategic in what we are doing in isolating hotspots and trying to stop it there. Other businesses, again, other operations that have shown not a lot of test cases so far have been very positive. The other part that I will starting to get a little bit of alert on is sports, and particularly youth sports. We're keeping an eye on that. We haven't seen a lot yet, but we're starting to see a little indication that youth sports might be, you know, what we thought about restaurants and bars 2 weeks ago when we were starting to get anecdotal reports about where that was going. And the test results have obviously borne that out over these last couple of weeks. So let's continue to be vigilant. Let's continue to support each other. Let's continue to work together by staying apart and wearing our masks and all the good things that we know we need to do. I'm going to ask Dr. Bogan to come up and talk in more specifics, and then we'll take some questions from the media. Dr. Bogan?
Thank you, Rich. Good afternoon, and thank you for joining us today. As you likely know, COVID-19 cases in Allegheny County have reached an all-time daily and weekly high. Today, we reported 96 new cases, and over the past 7 days, our total number of cases was 393. These numbers reflect a very rapid increase in cases, as well as significant rise in the percent positive among those tested, from a low of 1 to 2% just 2 weeks ago to over 6% for the past couple of days. The case investigators have been working overtime to reach all the cases and identify their close contacts. A few common themes we have seen from the case investigations are out-of-state travel, often with nightlife during travel, and going to local bars and restaurants. There were some family gatherings or celebratory group events, but no one location or event accounts for more than just a handful of cases. As we said at the announcement last week, these are primarily cases among young people, with more than 75% between the ages of 19 and 49. There was also a small increase in cases among children. As you can tell by the frequency of our press conferences, I am very concerned. I'm concerned because the rate of cases is rising rapidly, and because most of the cases do not have a known source, indicating that most are from what we call community spread. We went from nearly no cases of community spread to a lot very quickly. I'm also concerned because many of the cases have very mild to no symptoms, so are unwittingly likely spreading the infection to others. The scenario that worries me the most is that these young adults in their 20s to 40s have parents, aunts, uncles, and grandparents in the high-risk ages, and that they may be unknowingly bringing the infection to them. As the director of the county's health department, it is my duty to protect the health and safety of all Allegheny County residents. I and the health department's dedicated staff have done this during this pandemic by securing testing for our federally qualified health centers, working closely with long-term care facilities and others to manage outbreaks, and expanding the number of case investigators and contact tracers to keep going and to reduce the spread of the virus. Today, I am taking another step to protect the health and safety of all of our residents. Through my authority under the Pennsylvania Disease Prevention and Control Law, I am suspending the on-site consumption of alcohol at all facilities in the county. The consumption of alcohol inside bars, restaurants, nightclubs, and the like is particularly concerning to me. Drinking alcohol in these settings invites people to congregate, and the 6 feet we're supposed to keep from one another disappears. When people drink alcohol, they tend to lose inhibition, talk louder, get closer to one another, and can't adhere to the physical distancing and mask recommendations. There's a clear pattern among our cases in the past week. They visited local bars and restaurants, and many reported that masks were not worn by staff and patrons alike. Restaurants and bars will be permitted to continue offering dine-in services. However, alcohol cannot be consumed or served on the premises. To-go cocktails will still be permitted, but must be consumed away from the bar or restaurants. To emphasize orders already in place by the Pennsylvania Secretary of Health, I am also requiring masks at all businesses. This includes at restaurants except when seated at your table and either eating or drinking. Restaurants will be required to enforce physical distancing among tables, keep occupancy to 50%, and will be encouraged to prioritize outdoor seating. This order is effective June 30th at 5 p.m. Because many of our cases reported recent out-of-state travel, I am also strongly recommending all those who have traveled out of state to quarantine for 14 days after returning, or get tested and have 2 negative test results at least 48 hours apart. This will help reduce spread from those individuals. I'm confident our county has the testing capacity to handle it, and we will continue to work to continue to expand capacity. Locations such as our federally qualified health centers, Rite Aid, CVS, and MedExpress will offer testing to people who have traveled even if they aren't showing symptoms, but indicate that they have possible exposure. I want to say that I don't take these actions lightly, and I do so fully cognizant of the impact it will have on our county's economy. Our case investigators over the last week have heard many new cases that they have traveled out of state, often to hot spots across the country like Florida, Texas, the beaches along the Carolinas, and recently visited bars, particularly in the South Side and Oakland. I've been asked if I recommend that we return to a general shutdown or stay-at-home order. The answer is no. In March, we needed to take a sledgehammer approach to managing the virus because we were unprepared in this country and county to handle a large number of cases. We did not have enough personal protective equipment to keep even our healthcare workers and frontline staff safe. We were concerned that if our hospitals were overrun with cases and their staff got sick too, we would not have enough medical personnel to care for the ill. We also did not have wide availability of testing, and we did not have experience in diagnosing or treating COVID-19. That has all changed. We now have adequate PPE for our frontline workers. We have testing capacity. We know better how to manage the disease, and treatment continues to improve. Because of these changes, we no longer need the sledgehammer. Instead, we need a strategic and selective approach to identify the sources of the infections and shut them down and limit visits to these locations or events. I am making my decisions based on our case investigations and the best scientific knowledge we have today. We have not seen a significant increase in our local hospitalizations or deaths, at least not yet. Recall that hospitalizations lag cases by at least a week or more. Furthermore, the current cases of COVID-19 are mostly among younger than 50. According to data from the CDC, the rate of hospitalization increases steadily with each decade in age. For example, among those 18 to 49, only about 2.5% are hospitalized, compared to 12% for those 65 to 75, 16% for those 75 to 84, and 17% among those 85 or older. I worry that we will see a surge in hospitalizations in a few weeks when the parents and grandparents of the current cases become infected. We must slow the spread of the virus, and we must absolutely keep those most at risk from getting infected. I ask you all to pay attention and do the right thing. Take care of one another. Follow the green phase guidance to the letter. If you can, work from home and limit your activities outside of your home to those that are necessary. Wear your masks whenever you're in a business, outside if you're near others, on public transportation, or whenever you'll encounter others with whom you do not live. Please, don't enter businesses that are not enforcing the green phase guidance. They don't deserve your business if they're not willing to keep you and their own staff safe. First and foremost, you must stay home if you are not feeling well, even if your only symptoms is a mild sore throat, a runny nose, fatigue, or loss of taste or smell, and go get tested. And remain at home until your test results come back. And also get tested if you think you were exposed and have no symptoms. If you have recently returned from vacation out of state, and especially from a hotspot like Florida or Texas or the Carolinas, get tested and stay at home until you have your results of 2 negative tests. If you have a positive test, please answer the call from the health department and stay home for the full period of isolation. If you're contacted by the health department and are told you are a close contact of a case, you will be placed in quarantine. That means you are not to leave your home for at least 14 days from the date of the exposure, except to get tested or seek medical care. We have had a few people who we placed in quarantine violate these orders. We are going to enforce quarantine orders going forward. Remember, as always, to wash your hands, use hand sanitizer often, cover your coughs and sneezes with your elbow, not your hands, and clean frequently touched surfaces. I want to end with what you should do. You should not be afraid to go to your medical appointments. The medical facilities have all put in place careful protocols to protect their patients and staff. Please get your health care, your dental care, your eye care, your behavioral health care, your physical therapy, etc. What we don't want is for anyone to die from untreated medical conditions like a stroke, appendicitis, or a heart attack. You should also continue to check on one another, virtually or through the phone, if possible. Even people without the virus are suffering. The stress of lost jobs, parenting, school, events, that these numbers keep rising can be a lot. Please stay connected to one another and reach out if you need help. Thank you for your time, attention. Please be safe and be kind. Thank you.
We have a number of questions for you this afternoon. The first one you touched on, but would you please repeat your response to? Many local families have just returned from beach vacations and tried to get a test as a precaution upon returning, but didn't qualify because they had no symptoms. Can those families get tested anywhere?
So the answer is yes. When you go to fill out the sites, like if you go to a website to schedule an appointment for a test, one of the questions should be, do you have a potential exposure? And you should answer yes to that. Because of your travel, you do have a potential exposure, and that should open the gate for you to get tested.
This question is from the Tribune Review. Has the county received any communication from the state about returning to yellow?
I'm going to let Rich answer that.
No, not as of yet, because as Dr. Bogan said, this has been isolated to a couple of areas, and we're going to be very strategic. If you remember, in yellow, there were many other businesses that were shut down. We know this is a very difficult situation for many people, and we don't take this lightly. When Dr. Bogan and her team, make these recommendations, they certainly know the impact that it's going to have on the business community. However, if we don't get ahead of it now, we will have to shut down many more businesses and hurt our economy and put more people out of work going forward. So we're certainly in contact with the governor and the Secretary of Health, Secretary Levine, and they're aware of what we're doing here and are supportive of it. But at this point, we haven't seen some of those other operations that went from yellow to green that opened up. I'm talking about hair salons, nail salons, gyms, other operations. The contact tracing hasn't shown indications there. So at this point, we're going to stay where we are here. But again, things change so rapidly. We've seen literally within a week this thing just shoot up. So we don't know where we're going to be a week from now, 2 weeks from now, 3 weeks from now. We've all got to continue to be vigilant, or this thing could get out of control very quickly.
Has there been a number of COVID-19 cases that we've been told that we will need to move back to yellow from? That's a question from KDKA.
Again, this will be done with a lot of, it's not just the number of cases. That's certainly an important factor, but I know, as Dr. Bogan said, the hospital capacity, the seriousness, ICUs, ECMOs, all the things that come into play, and where the spread is. Again, one of the things we're fortunate at this point that most of the folks who have tested positive are in a non as risky category, being younger people and not having some of the underlying health conditions, but that could also change very, very quickly.
This question is from WESA. Is there any reason to be concerned about shopping with masks in retail or non-restaurant locations?
We have not, during our case investigation, that has not been something we've been seeing. So yes, I think it's very safe to go out. Again, do things like put hand sanitizer on before you go into a store. When you leave a store, keep your mask on the whole time. Keep yourself physically distanced from other customers. We have not really been seeing any reports of cases coming from those kinds of exposures. And again, what I've said is we are being strategic. We don't want to close down our economy again. We recognize that that's not good for people's health either. And so we're really trying to take a very strategic approach and only closing really as limited as we can to try to address this problem. So no, I encourage you, go out and get your groceries, go to your stores, and practice all of the requirements and recommendations that we've made.
This question is from the Pittsburgh Business Times. You've spoken a lot about what individuals should do, but what should businesses be doing now? Even if they aren't closed down, what steps should they be taking?
I think, again, limiting the number of people in a small business at a time, especially if it's a close place where it's hard for people to keep physically distanced, have hand sanitizer out for people to use, including their employees, and enforce the face masks. I was very disturbed last week when I got a photograph of a no face masks allowed sign in one of the businesses in our community, which just brought tears to my eyes as I see the case numbers rising. That is not okay. And so businesses should really just, if we follow the guidance, we should be okay. And what I'm seeing, and hearing stories about are people really not following the guidance. Most people are, but not everyone is.
Let me add to one thing on that. Yeah, I think all those things are good. Let me add to it vacations. Companies are, when their employees come back from vacation, as Dr. Bogan had recommended, get tested or possibly quarantine. Some people may have to take that extra week or two off if they've been to particularly if they've been to some of these hot spots, if they've been on an airplane, if they've been in a train, if they've been on a bus. Depending on where they're going, people that are returning, we know this is vacation season for a lot of folks. So we know a lot of folks aren't going to be doing vacation this year because they're going to put it off because of obviously the situation that's occurring around here and around the country. So just add also that companies should really be vigilant about when their employees return, particularly from out of state, to make sure that they're tested and or quarantined.
This question is from the Post-Gazette. Is the increase in the number of cases due to increased testing at all? And what percentage of Allegheny County's population has been tested at this point?
So I'm going to take those separately. So we definitely have an increased number of tests. There was a 3-day period where we tested over 1,000 people a day. But that is because we encouraged people to get tested. As we start seeing cases increase, we want to see more testing happening in our community. And that's an appropriate response. So yes, we're seeing more cases because more are getting tested, but we're also seeing a higher positivity rate because there's a lot more COVID-19 disease in our community than there was a few weeks ago. And then the other question is the total percentage of the population that has been tested. I will have to calculate that. I don't have it.
It's about between 2 and 2.5.
2 and 2.5%.
This question is from WESA. Could you just reiterate the bar closure goes into effect when?
June 30th at 5 p.m.
And does that mean that restaurants, unlike bars, are not thought to be a big site of transmission?
So there is some reports of restaurants, but they're all restaurants with large bars as well. And so we are encouraging really the bar part of those restaurants to close. And again, no serving of alcohol at any business on the premises is the guidance.
Are contact tracers asking or allowed to ask if the folks who are testing positive participated in protests?
Our case investigators ask about mass gatherings of all different types. Have they attended weddings, funerals, parties, protests, and been to other crowded places? So they ask about mass gatherings, and so yes, they do ask that.
This question is from WESA. Was it a mistake to go green when we did, and were any restrictions lifted that in retrospect you think should not have been?
That's a really great question, and I'm not sure I have a perfect answer. I think when people heard the color green, they interpreted it as go rather than as the guidance as it was stated. And so I think, again, we did recommend lots of things, but I'm not sure that guidance was always followed. I mean, we have been reinforcing physical distancing, and yet you drive by bars and there are people crowded together. And so I think had we followed the green guidance carefully, we might not be in this situation, but there were certainly not strict adherence to it.
This question is from the Pittsburgh Business Times. One of the things we have heard from readers are concerns about what to make of these numbers. The daily case numbers are higher than they have ever been and skew younger, but are the cases coming through mild, moderate, severe? What detail do we have on them?
Yeah, so the cases tend to be pretty mild, as I said. Many people with very minimal symptoms. Lots of people getting tested because of potential exposures. And that is what we expect to see in the population of people who are getting sick right now. And as I said in my comments, what I'm really concerned about is what happens when they bring those, because their symptoms are so mild, and that they might not even feel that they're sick at all, they may go visit people who are at higher risk. So that is my concern over the next few weeks.
This question is from the Post-Gazette. Do you know the number of nursing homes that have completed baseline testing of patients and staff as required by the State Health Department?
I do not have that information. The State Department of Health would have that information for you.
That is the final question, unless you have closing comments.
Yeah, I want to thank Dr. Bogan and her team, and I know my staff has also been working over the weekend as we pour through these numbers and try to make sense of what we've seen over the last week. I know Dr. Bogan and her team do not, and we do not make these decisions lightly. There was an awful lot of anxiety, an awful lot of thought going into what is the best way to do it. We know how important the economy is. We know how important the restaurant and bar economy is to our region. We want them to succeed. We want them to succeed safely. The question was asked about why not restaurants too. We want restaurants to be open, but we're also going to be very vigilant in making sure that we enforce the mask rule and encourage folks to be outside, because we don't want to go further. We don't want to have to do the next shutdown, but we may have to if these numbers don't improve over the coming days. So we're going to continue to monitor this. We're going to continue to have our contact tracers and test people out there. That's what's important, is that we're doing all these tests to find out where this spread could be, because until we have a vaccine, until we have a cure, we're going to be in this situation. There's going to be good weeks and bad weeks, good days and bad days, things that are going to open up, things that might get shut down, things that might get shut down temporarily, or things that might get shut down permanently. But it's really about all of us cooperating, doing the things we've been taught over these last couple of months from our medical experts who know this and are trying to keep us safe and doing everything they can to keep our families safe, to keep this community safe, and keep us moving forward. We know we're in a new normal, but we've got to all work together, and we've all got to support each other. And we've all, quite frankly, got to put a little pressure on each other to make sure we're wearing that mask when we're out in contact with people. And we keep our physical distancing, we keep our masks on, we wash our hands, we do all the things we need to do. Let's continue to stay safe. Let's turn those numbers around over the next couple of weeks and get back to what we all know is the best for this region. Thank you.